The informal assessment strategy which I will be discussing today is the annotated portfolio. The course that I had in mind when choosing this strategy was the clinical practicum course for medical radiography technology students. Before students enter their first hospital clinical practicum, they complete a college term where they acquire knowledge and skills in specific areas. One of the outcomes for the clinical practicum course is that students must apply the knowledge that they have acquired and the skills that they have learned to the clinical setting while x-raying a real patient. This particular annotated portfolio assignment gives students the opportunity to demonstrate how they have applied the knowledge and experience that they have acquired and teach others from their experience. This presentation will answer the following guiding questions. I'll begin by explaining the strategy. Next, I'll talk about the context in which this strategy would work best. I'll discuss the limitations and advantages of this strategy and some of the best practices. And I'll conclude by discussing how I would provide feedback to my learners. In this particular situation, the annotated portfolio strategy allows for the student to collect radiographic images from a case in which they were involved and share with their liaison and their peers. At the beginning of the term, students would be asked to keep a record of cases that they would consider using for this assignment, and ideally the assignment would be completed prior to the middle of the clinical term. The criteria for the image type is simply that the case would demonstrate either some of the students' best work or their most interesting work and what they learned. The annotated portfolio would give the student the opportunity to reflect on why they chose a particular case, what was challenging about the case, and how they might approach a similar case differently in order to be more efficient the next time around. It is an opportunity to apply theory and skills learned from school, such as the ability to take a patient history, to assess patient type and explain how appropriate care skills were provided, and what radiographic positioning option was chosen. It's also an opportunity to discuss radiographic anatomy and pathology in the area where the X-ray was taken, and to do a critique of the radiographic images to explain why they were deemed diagnostic. As previously mentioned, this strategy was considered with the clinical practicum term in mind for the MRT students. The classroom would be the clinical setting, and the liaison and a minimum of 2 and up to a maximum of 4 students, depending on clinical site, would gather together to share information and learn together. Some of the limitations that should be considered for this strategy will be that students would need a site visit at the beginning of the term in order to be introduced to the idea of portfolios. They would need a sample of work in order to understand what an ideal portfolio would look like. This would mean that as the liaison, I would have to choose a sample of my own work and do the assignment myself so that I could show students what my expectations were prior to the students sharing their own work. I would also need to develop and distribute a rubric that would need to be met in order for the assignment to be considered complete. Peer response cards or peer feedback cards would also be needed so that the students who were observing are motivated to share what they learned or what they would like to know more about. This may be somewhat time-consuming to create. Students may also consider that this assignment requires a good deal of effort and is quite time-consuming when their days are already kept quite busy during clinical practicum, acquiring workplace skills, becoming more independent, and needing to meet a certain quota of required cases to complete the term. Students would need some clinical time as well to gather sample work and would need assistance removing patient information from the radiographic images so that patient confidentiality could be maintained. There are a number of advantages to this strategy. Students would have the opportunity to apply learned skills and knowledge to real-life scenarios. It would also give students the opportunity to review concepts learned and go over assigned readings to be sure that the information that they are sharing is accurate. It would allow for the student to develop their ability to communicate effectively in sharing information. They would also be given the opportunity to self-reflect and self-assess. Having students share examples of their work would give the liaison, who does not work on site but simply comes for regular site visits, the opportunity to see samples of student work to ensure that students are progressing appropriately. If concerns arise, a discussion can be had with the student and the clinical instructor to make a plan for success before the student is too far into the term. There are several ways that best practice will be followed in this assignment. The assignment will take place early in the term so that there is ample time for those students who might need to receive extra assistance, and also time to remove patients' unique identifiers from the images. If concerns arise with the quality of the assignment, it is early enough in the term so that a discussion can be had with the student and the clinical instructor to make a plan for success. The liaison would provide a sample of work so students are aware of expectations. A rubric will be created and demonstrated, and the level at which the knowledge and skills are performed would be critiqued within the scope of practice of an advanced beginner radiography student to ensure that the assessment is appropriate for the level of learner. Feedback will be given upon completion of the assignment. The feedback will take the form of peer feedback. Peers will share what they learned, what caught their attention, or what they found interesting, and provide this in the form of verbal feedback following each presentation. The liaison will also have a checklist similar to the rubric provided to the students. Notes will be made during the presentation to provide feedback to the student to ensure that the assignment is complete. Thanks for listening to my presentation.